Hello, my name is Fiona Bengo, and today I'm going to talk about healthcare career options. So many people have been thinking that healthcare is all about nurses and doctors, but that's not right. Because healthcare has a lot of forms that someone can have a career in. There are non-clinical staffs and the clinical staffs. So the clinical staffs work directly with patients, while the non-clinical staffs, they work indirectly with patients. So I'm also going to give you some of the non-clinical stuff, non-clinical careers that you can find in healthcare. So let's start with the first one. So the first one we have is health information managers and technicians. So these ones, they manage the flow of medical records and other information. So some of the skills that they must have is that they must have a knowledge of medical terminology, medical law, and medical coding systems. So those are the skills that they're supposed to have. And also, in order for them to qualify to be healthcare to be health information manager and technicians, they must have a bachelor's degree in health information management. So the next one we have medical transcriptionists. So these ones, they transcribe recorded patient histories and clinical information. So some of the skills that they need to have is that they need to have the knowledge of medical terminology and the language and writing of medicine. So for them, the qualification that they need is they need to go to have associate degree in medical transcriptionist. Okay, so let's move on to the other. We have healthcare administrators. So for the healthcare administrators, their work is to oversee the organization and flow of a healthcare office or a project. So some of the responsibilities and skills that they need to have is that they need to have financial management, staff coordination, project planning, policy and procedure implementation. So for them, they must have a master's degree in healthcare administration so that they can be able to have that career path. So that was it about the non-clinical careers. So the next topic that I'm going to talk about is the allied health professionals. So you might ask yourself, what is the meaning of allied health? So this is a segment of healthcare field that delivers services involving the identification, evaluation, and prevention of diseases and disorders. So we have some allied health professions. So some of the profession in allied health are audiology. So the audiologists, they examine people who have hearing, balance, or related hearing problems. So for them, they mostly deal with hearing problems. So we also have dental hygienes. So for them, they provide preventative oral care under dentist supervision. They clean patients' teeth. So as dentists, it's all about dealing with the teeth. So for them, they clean the patient's teeth. The next one we have dietetics. So for them, they utilize scientific principles and methods in the study of nutrition. So it's all about diet. That's why they recommend some nutritious things that people can use. Okay, so we have cytotechnology. So they study cells and cellular anomalies using a microscope. And lastly, we have radiography. So for them, they assess, diagnose, and treat patients for a variety of injuries and diseases. So the last topic that I'm going to talk about is the nursing. So nurses are best placed to take an all-encompassing view of a patient's well-being. So they are the ones who normally take care of a patient's well-being. So we have some types of nurses. So the first type of nurse is registered nurse. So these ones provide critical health care to the public wherever it is needed. So for them, the education that they need is initial nursing education and a license from the government. So they have some key responsibilities that they need to play. So they have to perform physical exams and health histories before making critical decisions. We also have, they have to provide health promotion, counseling, and education. They also have to administer medications and other personalized instruments. They also have to coordinate care in collaboration with a wide array of healthcare professionals. So the second type of nurse, we have advanced practice registered nurses. So for them, the education that they have to hold at least a master's degree. So in addition to the initial nursing education and licensing required for all registered nurses. So some of the responsibilities that they need are they they prescribe medication, diagnose and treat minor illnesses and injuries. So they also certify nurse. They are also certified nurse, where they can be midwives. They can also provide gynecology and low-risk observatory care. They are they can also be clinical nurse specialists, which handle a wide range of physical and mental health problems. So the last type of nurse, we have licensed practical nurses. So they can also be called licensed vocational nurses. So this kind of nurse, they support the core healthcare team and work under the supervision of registered nurses and the other medical doctors. So some of the key responsibilities that they need to have, they have is check vital sign and look for signs that health is deteriorating or improving. So they ensure patients are comfortable, well fed and hydrated. So what they need to have is that they need to complete a state-approved educational program, which takes 1 year to complete. They also have to be licensed. So out of that, you have seen that there are a lot of career options in healthcare. Not only doctors and nurses, but you can also measure in other things. So that was my time. Thank you very much for listening. Goodbye.